Viewers, today conversation will explore the paradigm shift in medicine from traditional symptom-based treatments to process-oriented approaches. Additionally, we'll touch upon how India's rich Ayurvedic heritage, supported by forward-thinking policies of the Indian government under the esteemed leadership of Indian Prime Minister Shri Narendra Modi.
Honorable Prime Minister Shri Narendra Modi ji is trying to build Ayurveda into the market on an international level, and that motivates us as a healthcare company. This is the clinical trial I was talking about, body revival, and body revival is only to heal the mankind and support their detoxification process. I saw people coming to our offices and meeting my father and his team of doctors, and people being benefited with this product.
This is a book which is written by Dr. Ulrich Randoll, The Metric Concepts.
And so the whole logistics is shifting. And this principle you have also in your body. You have the substances, but when the logistics are just sticky areas, closed streets, then it doesn't arrive. And so I really would appreciate if these old traditions in India would really have a not only body revival, or if you do the research, then of course this will revival the body of everyone when you go back to the roots of your culture.
Hello and welcome to today's podcast, The Future of Medicine Embracing the Paradigm Shift. I'm your host Purnima Shukla. And today we are diving into revolutionary concepts in the medical field that are not only redefining our understanding of health and disease, but also setting new benchmark in treatment and healing. We are honored to have with us two distinguished guests who are at the forefront of this medical revolution. First, we have Dr. Ulrich Randoll, a pioneer in cellular biology and the developer of the matrix rhythms therapy. His research of the University of Erlangen in Germany led to the development of the matrix concept, which focuses on optimizing extracellular process through innovating treatment modalities. Dr. Randoll is also the founder of the Dr. Randoll Institute, a non-profit organization dedicated to advancing matrix research and integrating these groundbreaking findings into therapeutic practice for the public benefit. Joining us as well is Mr. Munish Khan, the visionary CEO of Health Reactive. Under his leadership, Health Reactive has built upon the legacy of body revival, which has been enhancing lives since 1996. While the product has a rich history, recent clinical trials have provided fresh insights and robust scientific backing, demonstrating body revival's efficacy in improving quality of life and progression-free survival for cancer patients. Mr. Khan will share his perspective on the strategic and operational aspects of bringing body revival into the spotlight with these new research findings. Thank you so much for coming here. Welcome to our podcast.
Thank you so much.
So, gentlemen, before I start formally begin with these podcast interviews and questions, I would like to spotlight the theme of this podcast so we can get a better idea and understanding what we are discussing today. Okay?
Yeah.
So, today we are trying to discuss the paradigm shift. Viewers, today conversation will explore the paradigm shift in medicine from traditional symptom-based treatments to process-oriented approaches that consider the logistics of nutrients, distribution and cellular health. We will also discuss how body revival is setting trends in the health market by offering a holistic approach to regeneration and immunity. Additionally, we'll touch upon how India's rich Ayurvedic heritage, supported by forward-thinking policies of the Indian government under the esteemed leadership of Indian Prime Minister Shri Narendra Modi. So we have our two distinguished guests today. First of all, I would like to start with Dr. Randoll. Dr. Randoll, our viewers want to know who is Dr. Randoll, why he's in India. What is matrix concept?
So thank you for the invitation first. What is matrix concept? Maybe I start a little bit with my background. My background is maxillofacial surgery. So many years ago, I was in Erlangen University doing research, especially on cancer patients, and the research starts because we had failures in our treatments. We used all the classical disciplines like chemotherapy, radiation and operation, but the things failed very often, and so you can very easily say I have the right concepts, but I have the wrong patients. Or you say I maybe have the right patients and the wrong concepts. That means where the results fail, innovation is needed. And so I started to pose the question, where does the pain come from? You have a personal pain, it's very individual, but now we want to treat individual pain randomized with randomized studies. Is it possible? And so, as it is individual, also the cancer is quite individual. Of course, you see at the end the structural changes in the, for example, squamous cells, but everybody has its own entrance to tumor. So I try to find out now the principles of cell division. And so I took video microscopes. These were high resolution video microscope where I saw in resolution about 250 nanometers. I could see inside the living cell, and therefore you need logistics. And so the whole logistics is shifting. And this principle you have also in your body. You have the substances, but when the logistics are just sticky areas, closed streets, then it doesn't arrive. And so I was dealing now with the processes of a human being. And then I saw that in classical medicine, we just have always the picture. We make X-rays, NMRs, histological pictures, but then I saw the picture is, the life is not a picture, of course, one picture of a whole movie, and that means it's a process. That means at the end, when we can say today, a symptom is not just a picture, it's the end of a derailed process. And so this is now the shift coming from structural medicine to processive medicine. That means we are focusing more the time basis than the structural basis.
Wow, very inspirational and lots of things to learn. I will now. I would like to ask Mr. Khan. Mr. Khan, there's very famous idiom which says Rome wasn't built in a day. Means like great things need time, approaches, efforts, and lots of patience. So when it comes to body revival, you are representing body revival. What inspired you to bring this product in market?
Purnima, thank you so much for having me here on your podcast show, and it's an honor to be here with Dr. Randoll, and I'm sure I'm gonna learn a lot today from him. And of course, these two separate topics. And uh, see, body revival. When you talk about body revival, it it's an Ayurvedic product. It was invented by our company founder Shri Munish Khan ji, who's my father as well. And I'll give you a little brief up about the history of body revival. So something related to what Dr. Randoll is saying, but he's of course he's a researcher and a well-known doctor. So my father, when I was growing up in my years, I saw my father always studying different kind of Ayurveda books, and he was always into the books, and he had a mission. He always used to tell us that I want to make a product, I want to make a supplement which can heal a body from inside. You know, when body becomes toxic, that starts getting illness, and when something goes inside and some product, and it detoxify your body and helps to regenerate the cells, that's when the person will start feeling better. That's what is thought. And uh, during 1995 1996 he himself fell very sick, and he used his own product, his own medicine to heal himself. And that's when the journey started from of body revival. He made up a team of his own doctors, and he registered his product, and with the Indian government it's registered with the Ayurveda Vibhag, Ayurveda department. He established one factory, he started manufacturing this product over there in Rajasthan. Then another factory was established in Himachal Pradesh, Baddi. Now we have two units in India, which is mainly manufacturing body revival. And body revival is only to heal the mankind and support their detoxification process. Yes.
So, recent clinical trial have been
Yes.
conducted over breast cancer patients. So, can you give some insights related to that study?
So the clinical trial, I joined this product because first of all it was in family business, and I saw people coming to our offices and meeting my father and his team of doctors, and people being benefited with this product, people being healed with this product without any side effect. So I joined this team, and I had a vision, and I was to say that I was motivated by first of all the progress of Indian government, how our Indian government is promoting what people say alternative therapy. Ayurveda, it's considered as alternative therapy everywhere. So Honorable Prime Minister Shri Narendra Modi ji is trying to build Ayurveda as a into the market on an international level, and that motivate us as a healthcare company, Ayurveda company, to make our product evidence based. So I got connected with the right people at the right time, and this clinical trial started. It went through a proper international protocol of clinical researchers. uh, it was they had to take permission from ethical committee, and it took around 1.5 year to complete the clinical trial, and it was completed, and the results was very wonderful, and it is there on the CTRI portal. The results, anyone can go and read the results. It's open for all healthcare professionals to check Body Revival's clinical trial. This is the clinical trial I was talking about, Body Revival. So
I would like to show to my viewers also.
how
To
Dr. Randall is saying that
Yeah, this is a book
yeah,
where
this
clinical
is the
trial
thesis of
thesis
clinical
of
trial. Yeah.
okay, health reactive clinical development. All
So,
right,
so
yeah.
how now the conventional doctors have started sending their patient to metrics because they started believing the uniqueness of this therapy, and it's the working. Similarly, when we have an experience of 28 years with body revival, it works internally, okay, on a cellular level, detoxification, immunity boosting. But when we gave this to the investigators for the clinical trial, they were surprised how it is working. Now similarly, we are receiving customers from conventional doctors when they are giving oncologists giving chemotherapy or radiotherapy to the patient, and they have gone through this clinical trial. They see that it reduces the side effects of, as per the mention in the clinical trial, that body revival subside the side effects of chemotherapy and radiotherapy.
So it
So
works along with chemotherapy.
yes, as per the clinical trial,
Clinical
it
trial.
does.
Okay.
Yes. So they are sending their patients to our office where our doctor see them.
Okay.
Yes.
Right.
So yes.
A great thing to hear. Like we have alternative supportive therapy for cancer patients also. Dr. Randall is how this product is helping humankind with their natural resources and ingredients. Yeah, they are using all our natural ingredients. So I would like to ask you advocate paradigm shifts. So how body revival get fits into that paradigm shift?
So the paradigm shift I'm talking about is just going from structure to frequency, from the structure to process. We come to a substance like body revival. Body revival is a very complex component that the body revival is full of energy. A healthy body you cannot make more healthy. That means there is no effect with body revival on someone who's full of energy, because if the fuel is full, you cannot make it more full. But if the fuel is less, then of course substances like I once tested years ago one of your father's bottles, and it was not enough, but I can say it doesn't harm.
Yes.
And I felt also not bad, but I in general feel healthy. And now, of course, we should really make trials on patients that are suffering,
Yes.
because they have the most benefit. A healthy person you cannot make no more healthy.
So absolutely, our clinical trial, our further clinical trials are going on. How Dr. Endol said that he didn't feel bad. So our main criteria while getting this clinical trial done was that whether the patient is able to tolerate body revival or not. So yes, they were able to tolerate. What is the benefit they are getting? So their benefit is mentioned. Now our further clinical trial is going on, and our R&D team is working on it with the doctors and scientists, and they're working on non-alcoholic fatty liver disease. along with we are being proposed to go for a clinical trial on heart diseases as well. So what I'm saying is this: it works on a human
If I
body.
interrupt, Mr. Randall is saying, Dr. Randall is saying, कि it differs person to person.
Yes,
The effect can be different from one person to another person.
absolutely.
So, like, if I want to know, if I want to have an understanding of it, so the body revival is only for the cancer patients, or it can be used by another people also as a normal
See,
supplement.
body revival is a product, you can call it a multi-powerful immunity booster and detoxifier. It can be given to any person. Of course, any supplement or anything when you're consuming, you should consult your healthcare professional and not just go by the words of your friends or family or anyone. Healthcare professional are the right person to suggest you, but it can be given to anyone as per our experience.
Yeah. Indian government is supporting Ayurveda in a huge way. We'll discuss it later. But before that, I would like to just give a second. This is a book which is written by Dr. Ulrich Randoll, The Metric Concepts. Dr. Randoll, I want to ask you that this emphasizes the information, formation, and form. Can you explain us what these principles are?
So the matrix concept, firstly, is a holistic management concept for just cellular systems. That means how can I manage the cells or the fishes in the water or in the in the extracellular matrix so that they stay healthy. So, and therefore you have to think about nutrition, about drinkings, about the food in general, how to feed it. And that means the cells need energy. So it's always an energy level. Also, when you're talking about the cancer or normal cell, it's a question of the energy. Where does this energy come from? And how does the cell produce this energy? And now we have the information formation form. That means, like an architect, he first has an information, he has the idea of a house. And then he starts, or our divine had maybe a picture how I want to make at the end a human being, and what do I need like this, you know? It's a creative process. And so also building houses is a creative process. You just have a piece of paper and you start to make your drawings, you know? And it's easy to change the ideas. That's not costly. But if you start already with the formation processes, when the lorries are coming, bringing the stones and the doors, the windows, everything, and if you want to change the color of the windows, then it's getting more expensive because the idea has come more and more into the materialistic side of the world. And if the house is finished and you don't like it, then it's very expensive. So this is now the connection between information, formation, form. And this is also with our body. We are what we eat, what we think, and what we do. So everybody is responsible for his shape. So the disease does not come through the window. You produce the disease, and everybody, I always say, has every diseases in his or her body. Yeah. So live a life that no disease comes out.
Absolutely, I absolutely agree with Dr. Randoll. I believe in this concept: you are what you eat.
Because
So only changing your lifestyle can
Absolutely,
be you
even I
change.
believe that we are designed
Yeah.
to heal ourselves,
Yeah.
whether the supportive therapy is a matrix therapy or by taking body revival or any other therapy. But yes, as long as we are alive, we are designed to heal ourselves. I
Okay.
believe.
And can I sum up in the way that people have not a basic understanding of problem? That's why they're not getting a right solution.
they have not understood the manual of life. Unfortunately, when you are born, you don't get the manual of life like when you buy a car, there's the manual. And before you are allowed to drive, you have to read the manual. So people just are born and then they eat with what the advertisement says. And this is sometimes not so good for the human body.
Yeah. So as we were discussing earlier about the Ayurveda, and you were taking that how government of India is supporting this whole process,
Yes.
how it can become the mainstream thing. However, it was ignored big time, labeled as it has no scientific validation. So if it comes to now, how will you illustrate or say that what initiative Indian government has taken to support Ayurveda?
It's a very good question. See, I will not comment on the technical aspects of this, but as an individual, if you take asking for my opinion, ever since Ayush department has established in 2014, there have been initiatives done by Indian government to boost the motivation of Ayurveda healthcare manufacturer or doctors. If you see recently, there is a WHO center established in Gujarat by Indian government. It is based for on integrative therapy, alternative therapy. It's not for allopathy or any other pathy,
Yeah,
but
supportive and
support.
alternative.
Yes, alternative therapy. Indian government is initiating award functions on a national level, on a private level, to boost motivation of Ayurveda healthcare professional. Last week of February 2025, Indian government, Honorable Prime Minister Shri Narendra Modi ji, mentioned details about the Ayurveda, how it should be research backed.
Yeah, in
How
his
I,
recent tweet, he
yes,
has discussed
if you have
everything, right?
seen
Yeah, yeah.
that tweet, that even the Ayurveda products and medicine should be research backed. You should do research. Once it is research backed, one there is a research human trial is conducted, and it becomes a evidence based. So yes, me as a representing my company, Health Reactive as a CEO, I feel motivated by the honorable Indian government, and we try to do our best.
And when it comes to body revival, you have talked about the awards and everything. Body revival is a product which has received many awards now. Bharat Healthcare Awards, which is very renowned and very respected award. So, how do you feel? How, what sense it gives you when your product is receiving such a recognition?
See, receiving recognition, whether it is national by the private agencies or Indian government, it is itself is a very prestigious thing. I would say that sitting here with Dr. Randoll itself is an award today, and we receiving a Nav Bharat Healthcare Award for best brand in Ayurveda, which is itself Nav Bharat is a very well-known name in the industry. It gives us more motivation to do good work and support the holistic wellness approach through body revival, and we try to do our best, and we will be doing our best.
And so I really would appreciate if these old traditions in India would
Right.
really have a not only body revival, or
Absolutely.
if you do the research, then of course this will revival the body of everyone when you go back to the roots of your culture.
Right.
This would be really great to do this. And as you see how powerful a remedy can be, like body revival, I just have looked a little bit to the research, and it is done, and this is a wonderful beginning, and this should be continued. We have to admire the nature. We are a product of nature and not a product from a company. Yes,
Absolutely.
this we have to consider. And so nature heals, and everything that we do from companies is just mostly a bad copy of something, and mostly it has many side effects.
And we can
I'll
yeah,
just,
please.
he's right, that bad copy of something. So that's what the founder of company, my father, Mr. Munish Khan, vision was that, we have a capacity of making 200 products, but from past 20 years we are only manufacturing body revival, because he believed that there is one body, and if it heals itself, detoxification happens. So the product is, he never made this product for any particular disease.
Yeah. So one more thing, like we are talking about the disease, problems, and solution. When you have all the solution have with you with alternative therapy, or you can say the mainstream therapy, allopathic. So why people should go for these therapies?
It's like another dish on the table, and the individual has to decide where he goes. And of course, the government, for example, or the insurances can decide what they will pay. In the so-called school medicine, I always say this is just the medicine that is paid.
Yeah.
But it is not, it must not be true. What is the truth, you know? So you can make many studies, and at the end, after 10 years, we see that some studies were made totally wrong, even published in Nature and in Science. So high-ranked papers, at the end, somebody cheated, for example. At the end, it's a question of the individuality and about the consciousness. For example, I don't eat remedies normally. Just I have maybe some vitamins, but I enjoy here in your country the coconut water. Nobody drinks coconut water here. You have everything in the coconut water. You have all the trace elements inside. You have also the energy level, the redox potential, and the pH correctly in the coconut water. That is the best you can do. People drink sugar drinks and all these things. They go to fast food chains, and this is exactly a question of consciousness and education.
Right. As I would like to ask the same question with
My
you, Dr.
point of view, Purnima, is this is individual choice. What pathy they want to approach, whether it's matrix, whether it's Ayurveda, homeopathy, or allopathy, it's individual choice, or as per their healthcare professional advice. But I believe that anything, whether it is matrix or body revival or anything, it should be research backed, science backed. Even the government supports if your pathy is science backed. What you're doing, whether it is a vibration therapy, it is science backed, and I believe that's what Dr. Randall is saying. So if as long as it's a research backed and science evidence is there, so it's individual choice what pathy they want to adapt.
Scientific validation is very
It's
important
very
for
important.
when we have reached a point where I just want to ask both of you if you want to give any suggestion to the healthcare professional who want to establish themselves in a medical field, like related to body revival or like metric concept. What your suggestion will be
To the young people, you mean?
to the young people?
To the young people, oh, this is very important. The youth is the future, and they have to start with the right books, with the right studies, and so they have to study again Ayurveda, the principles of Ayurveda, because the so-called scientific medicine we have just since 100 years, there it starts. And before we had thousands of years other views in medicine. And so we have to look to the experiences of our ancestors. And then, of course, with the most advanced tools, we should prove the evidence, that means the evidence of experience of our ancestors. And then we have a sustainable system because we just copy, optimize the nature. And this is the new way, or this is on what means new way. This is how medicine would become very interesting for youngsters, because they start thinking again and do not just do the copy paste and multiple choice things. And so they are really connected to the nature, to the patient, and patients are part of nature, as I always say. And so they perceive really what the patient is thinking, feeling, and what he shows. This is very important.
Yeah, nature are the best remedies. What's your take?
My take is that if, as a Health Reactive CEO, if I want to give suggestion to new CEOs, whether you are leading your own company or you're working in another company as a CEO, first of all, believe in the product. Which, if you're going to launch a new product or you're already working on a new product, first of all, you need to believe on that product, whether it's Ayurveda, especially because we are from Ayurveda field. And secondly, work on a research-based product. If your product is already in the market, do get scientific evidence, because it's really works wonderful for you. And evidence-based products is always appreciated. So work on that.
So that's all. I think we have got enough to have a better understanding related to medical field, Ayurveda, as well as the matrix concept. Thank you so much, both of you gentlemen,
Thank
for
you so much
coming
for
here and
having me
giving
here.
us an
Thank you so much,
insight.
Dr. Randall.
So,
Thank you.
thank you so much, Dr. Randall and Mr. Khan, for sharing your insights and expertise with us today. It's clear that both of you are not only advancing medical science, but are also committed to creating a healthier, more self aware society. To our listeners, if you want to learn more about the metric concept, body revival, and the incredible work being done by our guests, please visit the links provided in the description. Stay tuned for more enlightening conversation, and remember, true health begins with knowledge and the courage to embrace new paradigms. Thank you for joining us today.